Do you realize, despite how they make it seem, Medicare is definitely not free? In fact, the average beneficiary is on the hook for thousands and thousands of dollars every single year. To make it even worse, 3 of the most important medical expenditures are not even covered by Medicare. Well, that's what I want to share with you here in this video, because believe it or not, there's a handful of lawmakers that are out there right now actively working to get these 3 major medical expenditures actually covered by Medicare, and it would seem like probably the right thing to do, considering these are so incredibly important, especially for seniors and people with disabilities that are on Medicare. These just so happen to be a few of those expenditures that seem very, very weird that they are left out of Medicare, considering it is such an important program that is helping with the health care of those individuals that are 65 and above, or those individuals under the age of 65 who have disabilities. Well, I want to talk about all the details for you here in this video and what those 3 major medical expenditures are, which are very expensive, by the way, like a lot of money that would cost a lot of people a lot of money that they probably don't have because they're probably living on a fixed income benefit administered by Social Security. We're going to talk about all that here in this video. And I also do have this article right here, which I'm going to pop up in just a second so you can see and read for yourself exactly what this is talking about. And it also includes the details of those expenditures that I want to bring to your attention in this video. Now, drop a comment down below. If you happen to be on Medicare, let me know. About 66% of you in this community that watch these videos are on Medicare, according to the back-end analytics on YouTube here. Pretty amazing stuff, so congratulations. Which, by the way, those of you that are on Medicare, I want to throw this out there for you really, really fast, which is this. If you ever have questions on Medicare, if you need help finding the right Medicare plan and coverages for you and your personal needs, if you don't like your Medicare plan, if you feel like your plan doesn't cover you properly, if it's costing too much, if you can't see your doctor anymore, if your prescriptions are not covering you or they're too expensive, whatever the situation happens to be, do yourself a huge favor. Join the other 10,000 plus people here in this community that have called Chapter right there. Again, a few thousand of you so far just this year alone have contacted Chapter with that phone number to get free help with your Medicare plan. They have access to over 20,000 plans across the country. They will look through those plans. They will find you the right plan and the best plan for you and your personal situation. Again, they'll answer your questions. They'll spend all the time that you need on the phone with them, addressing your concerns, whatever it happens to be. And yes, you're going to connect with a real life human right here in the United States. They're based right here in the US, which is really awesome as well. And again, they will help you through this entire process. Take advantage of that. It's free. You can see it right there for yourself. Free. Again, those of you in this community, over 10,000 people just in the last 1 year have contacted them with that phone number there. And the really cool part about it, those of you in this community have collectively saved over $2 million just in the last year by calling them, which is really, really cool. Anyway, drop a comment down below after you talk to them. Use the word chapter within your comment so I can find your comment. That's the keyword I search for, and I'd love to hear from you and hear how it goes. All right, anyway, let's pop this article up right here, right now. Feel free to read through the details on this. Let's explain some of the situation on this. Okay, now here's the deal. And again, there's this misconception out there that Medicare is free. As soon as I turn 65, I'm going to go on Medicare and it's free for the rest of my life, right? No, not even close, right? Now, it can get close to free, but still, you're going to be on the hook for thousands of dollars every single year, regardless of the situation, but that's significantly lower than what it would have been if you just paid everything out of pocket. And if you didn't have Medicare, yeah, it'd be way more expensive. So yeah, I mean, it'll reduce the expenditures and the exposure significantly, but it's definitely not free. Now, here's a couple of things I want to point out. There's a few different major medical expenses that, again, are not covered, which seems very, very weird because you would think that these basic needs for people on Medicare would be covered. And that is hearing, dental, and vision coverages not covered. Yes, you hear that correctly. All of those are not covered whatsoever. So the examples that they give here in this article, for example, are like a crown. You know, you go to the dentist and you want to go in for a routine exam / cleaning, and they find that one of your teeth are cracked. Whoops, you need a crown now. Guess what? None of it's covered. Nada. Nothing is covered with original Medicare. Okay, what I'm talking about here, by the way, is original Medicare. Now, if you happen to be on maybe a Medicare supplement plan or Medigap plan, or maybe you have a Medicare Advantage plan, again, most people have one of these. I don't know your exact situation, but most people do have these coverages. Depending on your plan, it may have some built-in coverages for you a little bit for some of these different expenditures. They're probably not going to have a ton of coverage, but they may have a little bit depending on your exact plan. Now, again, if you want to see if there's a better plan option out there for you, something that offers some of these coverages as well, again, just call the phone number that's typically on the screen right here for chapter. Call them, see what optionality you have. By the way, that phone number is also linked down below in the description and at the top of the comment section. Call them. They can look through the 20,000 plus plans out there, see what options, what flexibilities you have, and they can help you find the right plan for you and your personal needs. But that's one of them, okay? Now, again, as it says in the article, a typical crown, about $1,500. Yeah, they are. They're expensive. And again, obviously it's going to range depending on where you're located around the country. But yeah, they can be very, very expensive. $1,500. That's nuts, right? That's just that. Now get this. Hearing, for example. Let's just say that you need hearing aids, right? According to the article there, hearing aids across the country, on average, between $4,000 and $6,000. That's nuts. Who has between $4,000 and $6,000 just laying around that you can just, I'm going to go get hearing aids today, right? I mean, here's the deal. For somebody that needs them, they're probably very, very valuable, as in you can hear the world around you again. That'd be really, really nice for a lot of people. But the problem is, where's a lot of people going to find this $4,000 to $6,000 to pay for these hearing aids that Medicare doesn't pay, right? Nuts of a situation with that. Okay, now vision coverages as well, typically not covered original Medicare, but rather, like I said, if you have a supplement, a Medigap, or an Advantage plan, a lot of times some of these coverages are built into them, but you got to be aware as well is that a lot of times the coverages that are built in are very limited, right? They have maybe like $1,000, maybe $1,500 worth of coverages or whatever it happens to be that they could pledge toward XYZ, vision or dental or hearing, something like that. But then once you use it up for the year, that's it. The coverages are gone or expended at that time, if that makes sense. Okay, so just be aware of that. And again, it's going to be totally dependent on what kind of plan that you have. But when it comes down to it, original Medicare does not cover these things whatsoever. No coverages at all for these types of coverages, okay? Now, also included in this article, I did not plan on talking about this one because I had a dedicated video recently talking about this, which is the $615 deductible on Medicare Part D, as in dog, right? We're going to say dog. Medicare Part D plans have a deductible for 2026 upwards of $615. Now, that's the maximum allowable deductible in 2026. Okay, so maybe you've already reached it at this point, being a couple months into the year so far, or maybe you're still chipping away at that thing. But either way, that's $615 that people need to come out of pocket to get their prescriptions before the insurance pays anything, the deductible, right? The nasty deductible that resets at the beginning of every single year that a lot of people really struggle to pay. But that's another one that is out there and that I wanted to talk about. Okay, now let's quickly talk about some of the lawmakers that are out there and what are they trying to do. Some of the lawmakers, most notably Bernie Sanders and some of his buddies, are talking about expanding Medicare to include hearing, dental, and vision coverage. Now, they've been talking about this for years. To be fair with you, they've been talking about expanding Medicare to include these basic services for quite a few years. Hasn't done anything about it, right? They have not been able to pass this. They have not been able to get these services added into Medicare and added to original Medicare coverages. So therefore, here we still sit and awaiting that to be added into original Medicare coverages, but as of right now, it is not. But this is where, again, I really want to emphasize this is where your Medicare supplement / Medigap plan or your Advantage plan comes in, because these may, I really want to emphasize, may provide some type of coverages for these basic necessity services that are not covered by original Medicare. Not all of them. Again, I don't know your plan specifics. Again, there's over 20,000 plans across the country, so it's literally going to be different for every single plan that's out there based on your region, where you're located around the country, the specific plan options you have available to you, things like that. But point being is that you, some of these plans do offer some limited coverages in these specific areas, but just remember, the coverage is going to be relatively minimal, and it's probably going to be used up relatively fast, especially for something like, let's just say, dental coverage. You're probably going to get somewhere around $1,000. Again, I don't know, I'm just using this as an example. You may get somewhere around $1,000 for the entire year. That's like one dental visit, right? That's like a couple cavities. That's maybe a portion of a crown. It's going to be used up pretty fast, right? But then once it's gone, you're on the hook for the rest of the expenditures for the rest of that year, okay? Anyway, if you're on Medicare, if you need help with your Medicare, if you have questions on Medicare, if you hate your Medicare plan, if you feel like it doesn't cover you properly, if you feel like you can't see your doctors, can't go to the office, can't go to the clinic, can't go to your hospital system, your medical procedures aren't covered, your prescriptions are costing too much, the plan costs too much, whatever the situation is, does not matter. Please contact Chapter There. Phone number's there for you. Give them a call. Again, about 10,000 of you in the last year have called them. A couple thousand of you so far this year have called them, collectively saving over $2 million just in the last year or so. From those of you in this community, give them a call. Again, they have 20,000 plans that they have access to. It's actually more than that. It's about 24,000 plans that they have access to. They're going to look through those plans. They're going to spend all the time that you need on the phone with them, addressing your concerns, answering your questions, searching the plans, asking for your 3 Ps. They want to know your 3 Ps, your providers that you prefer, as in doctors, your prescriptions that you're taking, whatever those happen to be, and your preferences. They want to know all that, as in your wish list. What is it? Okay, they want to know all that so they can properly serve you and find you the proper plan for whatever it is that you need for the year or whatever it happens to be. Okay, anyway, take advantage of that. Free. You can take advantage of it. It's totally free. Otherwise, let me know what else I can do for you. Just want to bring this to your attention really quickly. Otherwise, if you're new here, if you have not done so, please consider subscribing. 100% free. Big subscribe button down below. Please share the video. Share button down below. Otherwise, check out the well over 6,000 videos here on the channel in the video library. Otherwise, have a nice day. Hope this helps you. And again, as always, drop those comments down below and let me know what else I can do for you. Comments, questions, concerns, whatever it happens to be. Otherwise, have a good one. Take care, and I'll catch you again later in the next video. See you.